So she previously had a history of skin cancer. It was removed here from her chest. Do you know what the diagnosis was? Was it basal cell?
Yes.
That sound right?
Yes.
Okay. Make sure that it's not something that needs to be further evaluated for the possibility of skin cancer. Have you had skin cancers in the past besides that one?
Just this. Yeah, because I'm pretty fair-skinned, and when I was younger, I did a lot of tanning.
So I think there's a possibility it could be a skin cancer, especially with your history of skin cancers and the way that it looks. The only way to know for sure is to do a biopsy.
Okay.
I think kind of regardless, though, my recommendation would be to remove it, so that way it'll be diagnostic and therapeutic. Diagnostic from the standpoint of it'll tell us what it is, and therapeutic will get rid of it at the same time.
Okay.
So like I said, there's a couple ways we can manage this, but I think because of where it is, the location, and we want the ending scar to be as inconspicuous as possible, obviously, because it's on your face and in an area that is what's considered cosmetically sensitive. A biopsy today, it's called a shave biopsy, that would at least be diagnostic, meaning it would tell us what it is. The problem with that is it probably won't be therapeutic. If it is a skin cancer, we have to come back and take additional tissue out to make sure that it's completely cleared and that it doesn't come back. And then from an outcome standpoint, I think it would probably leave like a little circular divot or crater that wouldn't look aesthetically as inconspicuous as if we actually excised it surgically. Typically for this area, if we were to excise it surgically, smile. So everybody's got natural, they're called relaxing tension lines in that area that are oriented depending on where the muscles in the face are. So when you smile, and actually it also corresponds with the orientation of the lesion itself, and we take a little bit of some margins on both sides and then take it off in a way that's geometrically going to make the most sense to get it to heal up the most inconspicuously, so that there's not any bunching. It just lays down like a flat scar. So basically we're talking about doing something like that. So that would be like it's called a full thickness excision. This is what you would call an excisional biopsy, meaning that we're taking out the entire lesion and sending the entire specimen and sending it to pathology to have them look at it and tell us, one, what it is. They're going to say it's either skin cancer or it's not. It's all one surgery, the excision, the closure. I mean, obviously there's always a possibility that it could come back with a positive margin, in which case we might need to go back and take more out, but I think that's unlikely, and if this were to happen in that location, it wouldn't be the end of the world. It would just take slightly wider margins, but I think all those things considered, the right recommendation for you would be to schedule the procedure. Dr. Liu does these procedures, so we would schedule you with him to basically do the excision and the closure.
Okay.
And your insurance is with who?
It's United Healthcare.
Okay, so we would just get the approval ahead of time. We've got all the documentation that we need. We'll do photos if we haven't already yet. That'll be the photo documentation in case for whatever reason the healthcare company comes back and says they want to see photos, and also for internal documentation purposes, but I don't think that's going to be necessary.
And that's something insurance would pay, right?
Yeah, I think so. From my perspective, and this is how we reflect it in the medical record, it's medically necessary. It's not for appearance-related issues. I think there's a potential there that is related to an underlying skin cancer, so typically the insurance companies will consider that medically necessary. If it was like a completely benign lesion, they may not cover it unless it was symptomatic, like growing or itching or burning or tingling or bleeding or something that actually they would consider medically necessary. Because you've had the prior history of skin cancer and this particular area has got some features to me that are concerning for basal cell carcinoma. If Robert zooms up, you can see there's things called, it's like a pearly border, telangiectasias, these are all very kind of pathognomonic types of diagnostic words that make it more likely that it's a basal cell skin cancer. So it's our job to make sure that it's not. And I think the only way to do that appropriately in your case would be to do that surgical excision.
Okay, that sounds good to me. I'm
All
fine
right,
with it.
we'll kind of get started with the insurance approval process, and then I'll give you a call and get it scheduled.
All righty, thank you.
All right, my pleasure.
That was
It was very
quick.
nice meeting you.
You too.
Take care.